Welcome back to Thrani, I'm Joe B. Do you have an aching buttock pain that shoots to the back of the thigh and to the back of the knee? If so, then you may have a forward sacral torsion, and this video will help you how to deal with it. Let's dive in. A forward sacral torsion is a dysfunction where the anterior surface of sacrum faces inferiorly or downward and to one side. When the front or anterior surface of sacrum faces down and to the left in such a way that the left inferior lateral angle is backward or posteriorly, then it's called a left-on-left forward sacral torsion, where the first letter L pertains to the direction that the front surface of the sacrum faces, and the second L pertains to the left ILA being more prominent. If it is the right ILA that is backward or prominent, with the sacrum facing down and to the right, then it's called a right-on-right forward sacral torsion. The cause of this can be due to trauma, and a forward sacral torsion can bring about a sacroiliac joint pain above the ischial tuberosity but below the belt line. The pain shoots to the back of the thigh and to the knee. The assessment for a forward sacral torsion requires the patient to do a seated sacral extension or slouching test, since it makes the dysfunction be more prominent for easy diagnosing. There are two bony landmarks to palpate: the sacral basis and the inferior lateral angles. To palpate the sacral basis, the patient must be in a relaxed, erect, short sitting position with hands across the shoulders and feet flat on the floor. The therapist should be behind the patient with eye level at the sacral base or L5 spinous process. The first web space of both hands palpates the iliac crest first, then both thumbs reach down and medially to palpate the posterior superior iliac spine, or the PSIS. From there, the thumbs go up and medially by one finger breadth to arrive at the sacral basis. After that, the patient is instructed to slouch the low back, resulting to sacral extension and lumbar flexion. Normal findings are that the sacral basis move backward or posteriorly and becomes shallow. Abnormal findings, if you have a left-on-left forward sacral torsion, is that the left sacral base will be slightly posterior or backward than the right sacral base. For right-on-right forward sacral torsion, then the right sacral base will be slightly posterior or backward than the left. To palpate the inferior lateral angles or ILAs, the patient and therapist position will be the same as with the palpation of the sacral basis. Both thumbs will slide down from the iliac crest to the PSIS. Then the dominant thumb palpates the S2 spinous process, then S3, and S4. Once S4 is reached, the thumbs will go 2 to 3 finger breadths inferiorly and laterally to arrive at the ILAs. The patient is then asked to perform a seated sacral extension or slouch the low back, which results to sacral extension and lumbar flexion. Normal findings are that the ILAs move forward or anteriorly or becomes deep under your palpating thumbs. Abnormal findings, if you have a left-on-left forward sacral torsion, is that the left ILAs will be significantly more posterior or backward than the right ILA. For right-on-right forward sacral torsion, then the right ILA will be significantly more posterior or backward than the left ILA. For the treatment, for instance, you have a left-on-left forward sacral torsion, then the sacrum is in flexion, right side bending, and left rotation. Side bending and rotation are always opposite in this dysfunction. The objective is for the sacrum to oppose that motion by treating it to go to extension, left side bending, and right rotation. So the treatment is a combination of non-thrust mobilization and positional correction. The patient is in left side lying close to the edge of the table with hips and knees extended. Therapist is facing the patient. The therapist's left hand flexes the hips and knees to encourage sacral extension while monitoring movement from the L5 spinous process. Any movement from there should prompt the therapist to stop the hip and knee flexion any further. The right hand pulls the patient's right shoulder down to cause right lumbar side bending and left sacral side bending. Then the right hand of the therapist is repositioned to the patient's right posterior shoulder to introduce left lumbar rotation, which will result to right sacral rotation, and can hold the position for 30 seconds. Then repeat the process for 3 more reps. Another exercise can be a prone lower trunk rotation with the chest facing the treatment table while the hips and knees are flexed 45 degrees to the right side. So do you want to learn how to correct a backward sacral torsion dysfunction? If so, then this video is for you. Thank you so much.